Hello everyone. Thank you for attending today's webinar introducing AHRQ's Expanded Practice Facilitation Training Curriculum. My name is Jay Crossan and I'm a senior researcher here at Mathematica Policy Research. Before we begin, we wanted to cover a few housekeeping items. Alex, can you click on this? At the bottom of your audience console are multiple application widgets that you can use during this webinar. If you have any questions during the webcast, you can click on the Q&A widget at the bottom and submit your question. We'll try to answer these during the webcast, but if a fuller answer is needed or we run out of time, it will be answered later via email. We do capture all of your questions, so please keep them coming. A copy of today's slide deck and additional materials are available in the resource list widget that looks like a green folder at the bottom of your screen. You can expand your slide area by clicking on the maximize icon on the top right of the slide area, or by dragging the bottom right corner of the slide area. If you have any technical difficulties, please click on the Help widget. It has a question mark icon and covers common technical issues. You can also submit technical questions using the Q&A widget, and we'll try to get to them as soon as possible. An on-demand version of the webcast will be available approximately 1 day after this webcast and can be accessed using the same audience link that was sent to you earlier. Now I'd like to introduce Bob McNellis, Senior Advisor for Primary Care at the Agency for Healthcare Research and Quality. Bob, you have the floor now.
Great. Thanks a lot, Jay. Appreciate it. Great being here with you again, and thank you to all of you out there. I appreciate you joining us today. As Jay mentioned, I'm Bob McNellis, a Senior Advisor for Primary Care here at AHRQ, and really it's a pleasure to welcome you to today's webinar. As Jay mentioned, this is sort of our fifth and final webinar in a series designed to introduce you to our soon-to-be-released Expanded Practice Facilitation Curriculum. In the first webinar, we set the stage by highlighting 3 exemplary practice facilitation training programs that informed our thinking. Last October, we provided a sneak preview of the EHR and HIT modules from the curriculum. In December, we described how various modules can help practice facilitators work with practice leaders to build a culture of safety in their practices. And last month, we provided some insights on how some of these modules from the curriculum can be used to help practices facilitate patient engagement, both in the patient's own care as well as the delivery of care in general. And I got to say, if you weren't there, you got to go listen to it because it was a great webinar. Lots of great conversations and great material and information for you. But now moving on to today, we're going to do 3 things for you today. And first, we're going to give you a look behind the curtain and share with you how we've designed the curriculum to dovetail with competencies for the growing practice facilitation profession. Second, we'll provide additional detail about how the new modules will fit into the existing practice facilitation handbook. And we'll offer some suggestions for delivering that content. Third, and this is going to be actually my favorite part, I think, we'll hear from leaders here at AHRQ and at the Center for Medicare and Medicaid Innovation on how this curriculum can help address the needs of the field. We do have an exciting day for you. Next slide, please, Alex. Now, before we go to those exciting places, let me provide a few words about AHRQ's work leading up to the development of the curriculum. As many of you probably know, and you've heard if you've joined us in any of the previous webinars, AHRQ's mission is to produce evidence to make healthcare safer, of higher quality, more accessible, equitable, and affordable. And we also partner with others, like you and your organizations, to make sure the evidence is understood and used. Consistent with that mission is AHRQ's belief that primary care is the foundation for a healthcare system that delivers that safe, high-quality, accessible, equitable, and affordable care. But, like many of you, we recognize that primary care is under pressure from many different forces today. So we've invested in research to help understand the best approaches to support primary care practices as they transition from old models of care delivery to newer models that emphasize better patient outcomes, better experiences of care for patients and clinicians, and help lower costs. It's clear that many primary care practices, especially smaller practices, onesies and twosies, 4, 5, 6, practices that aren't part of big healthcare systems, need some kind of outside expertise, or what we've begun to call an external infrastructure to support them as they work through transformation and efforts to improve quality. We see practice facilitation as one important evidence-based strategy to assist practices as they move to delivery models like the patient-centered medical home. And practice facilitation can assist with the ongoing quality improvement efforts needed to make these substantive changes. Next slide, please, Alex. Now, we've done a lot of work in this area already, and I want to make a plug for some of that work. What you see here is a screenshot of AHRQ's PCMH Resource Center. On this page, you'll find white papers, briefs, and a variety of other resources that help support practice transformation. This is also where you'll find the curriculum once we have released it. The link to the page is at the bottom of the slide, and that's pcmh.ahrq.gov. Next slide, please, Alex. Now, I do need to say that AHRQ is not new to practice facilitation. We published our first practice coaching manual back in 2009. It was created as an adjunct to other strategies supporting chronic care management in safety net practices. In 2010, we convened a conference on practice facilitation, which set some of the direction for our current work. In 2011, we released a how-to guide for organizations interested in developing practice facilitation programs. And in what seems like just yesterday, but was back in 2013, we released the Practice Facilitation Handbook. It has served as the foundation for the development of this new curriculum. Next slide, please, Alex. So this is just a graphical image to show you how we think our portfolio of practice facilitation products work together. And frankly, the curriculum slots in nicely between our how-to guide for organizations that want to develop or begin practice facilitation programs and the handbook from just a couple of years ago. Next slide, please, Alex. So let me just say a couple of words about the expanded primary care practice facilitation curriculum itself. You'll hear more about it during the rest of the webinar, but the curriculum has been developed by AHRQ and the Mathematica team to support the education and training of primary care practice facilitators. This new curriculum builds on our current practice facilitation handbook that was authored by Lindy Knox at LANet and Cindy Brock here at AHRQ. We've added new modules and enhanced existing ones. We're linking them with our competencies development, have created an instructor's guide focused on adult learning with suggestions about assessment, and have added many student resources and additional information to support the delivery of the curriculum through different modalities. When will you see the curriculum? Well, that's a good question. And what we're really hoping for is a spring release, perhaps late April, early May, I think is when we'll be able to release it. Don't hold me to that, but the good news is that if you join our practice facilitation listserv, you'll be one of the first to know when it becomes available. And Jay will talk a little bit more about at the end of the program about how to join that listserv. So next slide, Alex. And why don't you go to the next one after that? Oh, that's perfect. That's just the place to be. Thank you. So all of this would not be possible without the team at Mathematica and LANet. And I want to call out Dr. Jay Crossan and Dr. Lindy Knox, who you'll hear from shortly. They have done a tremendous amount of work to develop this curriculum. Much of it has been created from scratch. It's just amazing. We're also grateful to our technical expert panel, and the members are listed on this slide. They set us on the path at the start. They've guided us along the way, and will give the last word on its readiness to go live. And on behalf of AHRQ, I want to thank this impressive group of experts for all their time and contributions to the curriculum. Next slide, please, Alex. On to today's program. Well, here you see the agenda for the next 80 minutes or so. We're almost done with the introductory remarks, so we can get to the more interesting discussions. There'll be an opportunity for questions from the audience about the curriculum, and we look forward to getting your questions and encourage you to ask them. Also, please stay tuned for the top of the hour for the discussion about the broader implications of the curriculum to practice facilitation, to primary care, health systems change in general from our guests. Next slide, please, Alex. This is going to be a list of the people who you're going to hear from today. Jay and Lindy will walk us through various aspects of the curriculum. Then Lindy will moderate a discussion with Dr. David Myers, who's Acting Director for the Center of Evidence and Practice Improvement and Chief Medical Officer here at AHRQ, and Dr. Darren DeWalt, who's currently the Director of Learning and Diffusion Group at the Center for Medicare and Medicaid Innovation. I think it's going to be a great discussion. and I can't wait to hear it. So with that overview, I'm going to turn it back over to you, Jay, to get on with the show.
Great. Thanks, Bob. For this section, I'll give a short definition of practice facilitation and then talk about the prior work we're building on that Bob mentioned briefly and the objectives of the expanded curriculum. Next slide, Alex. So what is a practice facilitator? Practice facilitators are specially trained individuals who work with primary care practices to make meaningful changes designed to improve patient outcomes. They help physicians and improvement teams develop the skills they need to adapt clinical evidence to the specific circumstance of their practice environment. Later today we'll be hearing from Dr. DeWalt, who's the developer of this definition. And today we'll introduce an expanded curriculum for training practice facilitators to prepare them for effective work with primary care practices. Next slide, Alex. The core competencies needed by primary care practice facilitators that we've identified build on prior work funded by AHRQ. The 2010 Consensus Meeting on Practice Facilitation for Primary Care Improvement developed a list of competency areas needed by primary care practice facilitators, which included a mix of content mastery, such as knowledge of primary care practice, diffusion of innovations theory and organizational change, and applied skills, such as quality improvement methods, use of health information technologies, and communication. A subsequent guide, Developing and Running a Primary Care Practice Facilitation Program, refined these core competencies to focus on interpersonal skills, generating and using data, and quality improvement or change management methods. Building on these prior resources, the 2013 Practice Facilitation Handbook added practice assessment and health information technology optimization to the list of core competencies and began the process of creating instructional resources to support these competencies. In preparing the expanded practice facilitator curriculum that we're presenting today, we examined these prior resources as well as the practice facilitation resources offered by 21 different primary care practice facilitation training programs or organizations. We documented commonly identified competencies as well as some areas that, while not commonly identified, are, we think, nonetheless important to primary care practice facilitation. And then we conducted, as Bob mentioned, more in-depth case studies of 3 exemplary training programs. Next slide, please. The core competencies and objectives of the expanded curriculum continue this focus on building content mastery needed for practice facilitation, including the knowledge of the primary care environment and how it's changing, and how organizations themselves change, as well as the specific applied skills that practice facilitators will need to help practices make change in that environment, including facility with quality improvement methods, information technologies, and facilitating practice-level meetings. Next slide, please. For the purposes of the expanded curriculum, we grouped all of the practice facilitator competencies that we documented into 4 distinct domains of knowledge and skills needed for supporting primary care practice transformation. Foundational knowledge is the familiarity with key topics important for improving and redesigning primary care, such as organizational change processes, the principles of the patient-centered medical home, and familiarity with the changing primary care practice environment, including regulatory and policy changes. The general skills domain includes competence in applying foundational knowledge to various transformation tasks, including basic quality improvement methods, assessing practice readiness for change, and people, project, and meeting management skills. The specialized skills that practice facilitators will need include competence in the use of specific techniques to support change, such as the use of information technology systems and work process engineering methods. Professional skills, knowledge, and commitment include developing competence in the use of effective communication techniques, and especially establishing trust with practice staff members, as well as knowledge of practice facilitation as a national community of practice, and a commitment amongst practice facilitators to lifelong learning. Next slide, please. As a whole, the expanded curriculum is intended to build the competencies that many consider necessary for effective practice facilitation. These competencies, however, need to be combined with professional standards to ensure that practice facilitators can serve effectively as a force for transforming primary care. These standards include transparency, or the ability to clearly communicate the facilitator's own interests in the change process, including who employs them and what the objectives of their employer are. Self-evaluation is also an essential skill needed to support ongoing development of skills to address knowledge gaps and the need for new techniques, and thus plays an important role in the commitment to continuous learning needed to develop skills and adapt to changes in the primary care landscape or policy environment. Finally, a commitment to quality improvement is needed to keep the focus of practice facilitation on the spread of knowledge and best practices within the primary care community, and to keep the focus on improving population health. Now, I'll turn things over to Lindy Knox to show you how the knowledge and skill domains that I've talked about are represented in the expanded curriculum, and to give you a brief taste of some of the modules that will soon be publicly available. Lindy?
Thank you so much, Jay. And welcome, audience. I'd like to encourage everybody who's listening who has questions about the curriculum that they'd like to talk about. We're having a Q&A portion coming up soon, and so please post your questions so we can address them. And now what I'd like to do is just give you guys a brief kind of glimpse into this curriculum, a little bit about its table of contents, a peek at a few of the modules, and really my hope is that today I can inspire you all as members of the audience to go online, download the curriculum, and take a deeper look at it. So let me go ahead and move on in to the next slide, please, Alex. And the first thing I'd like to do is just point out that the curriculum's been developed around basically 5 key sections. And the first one is really about preparing those trainers, because this is a curriculum not just for the facilitators, but it comes with resources for those individuals that are going to be training those facilitators. And so there's an excellent beginning module that really provides type of adult education, grounding, and methodology that people need to deliver this curriculum well to facilitators. The second section is an introduction to practice facilitation, and again, this curriculum is designed for new facilitators in general, although it's useful really to any facilitator. I think one of our presenters may not be on mute. If you all could just make sure that your phones are on mute, that would be great. Thank you. So an introduction to practice facilitation for those that are new to it. And one of the things that we really promote in the curriculum is this idea of drawing from expertise within your team. And so if you have facilitators that are more experienced, the idea of engaging these as co-instructors as part of this curriculum. In the third part, we talk about just kind of general competencies that facilitators need. For example, understanding theories of quality improvement, basic approaches to quality improvement and practice transformation, and understanding about the patient-centered medical home principles. The fourth section of the curriculum focuses on things that the facilitators do directly in the practice. For example, how do you hold a kickoff meeting? How do you explain to a practice what practice facilitation is? One of the key lessons learned for me as working out in the community was many times our practices didn't understand what a facilitator was. And they might think of us as a compliance person or as an auditor. They did not know what to do with us. And so one of the things we learned very quickly to do is to develop almost an elevator pitch that we could use with practice leaders, clinicians, staff, so that they began to understand what we were and how we could support them. And so the curriculum provides some training. It even has your facilitators kind of go through some exercises where they become comfortable giving this kind of brief orientation kind of pitch to the practices, because several times we found when we were first learning to do this that the practices, when we get to the end of the intervention, would say, oh my gosh, if I'd only understood at the beginning what you could actually have done and helped us with, we would have engaged you a whole lot more. So these types of very, very practical skills that come from people that are out working in the field. This knowledge is based and drawn from people that are boots on the ground out there, like Melinda Davis and her team in Oregon, like Anne Lefebvre and her team in North Carolina, Allison Gottsman and her team in Colorado, the folks in New York. These are people that have been doing this for many years. The final section is really heavily focused on the intricacies of the patient-centered medical home and the care model, things like how do you help a practice implement team-based care? And then when they implement it, how do you get those teams to work well together? How do you hold good meetings? Meetings are a critical part of any kind of change effort, and they also can be a powerful tool for setting the culture and climate of an organization. What's the role of the facilitator in this, and how can they help practices learn to run their meetings in a way that really promotes a culture of inquiry, learning, and quality? So with that, now I'd like to give you a quick glimpse into the table of content. So Alex, if you could change the slide. Thank you. Hopefully you guys can see this. It's a little scrunched, and like I said, I'm really trying to inspire you to go online and download this when it's available in the spring. But you'll see that there are a variety of different modules, and in this table you'll notice where they map to the core competencies of practice facilitators, of a beginning practice facilitator. And these competencies were designed, as Jay mentioned earlier, based on input from several groups over the last 5 or 6 years, and based on this technical advisory panel whose names you saw at the beginning. And also, they were drawn very heavily from both Alison Gottsman's work in Colorado and then Anne Lefebvre in the North Carolina AHRQ and their facilitation program, which is really based on work with thousands of practices and over many years. And so again, they're very pragmatic. They're really designed to give the facilitators something very practical and immediately useful for them in the practices. So let's move to the next slide so you guys can see the remainder of the modules. And there are some new modules here. This builds on the work of the PF handbook, the Practice Facilitator handbook that Cindy Brock and I developed a couple of years ago, but it expands the content of that handbook. So we've added modules on things like how would a facilitator use appreciative inquiry? One of the things we found is that practices oftentimes become very burned out on change, and they also feel kind of beat up. Oftentimes the approach to quality improvement can be to point out, well, you're doing this wrong, let's do it better, which I think for all of us can become a painful experience. And so the appreciative inquiry is an approach that's really strength-based, and it starts with beginning to look at what an organization is doing well, and then how can we spread that. And so there's a new module to help practice facilitators begin to incorporate this kind of asset-based or strength-based approach to quality improvement, especially for practices that may be more defensive when you first start working with them, maybe the ones that are more burned out or particularly stressed. There's a new module on root cause analysis and how to help practices understand and improve their performance. So you get your performance data, but then what? How do you know why you're performing that way? And so there's training for these facilitators to help them then work with practices to really analyze what lies under that performance data. Why are we falling off that metric? Why are our patients feeling uncomfortable or dissatisfied with care? Why are we not getting those A1Cs like we thought we were? And so it's a set of tools to help them do that and teach practices to do that. There are also new modules on running effective meetings, which I guess I already covered, so let me skip on for that. Working with practice leaders. So if you can't engage the leader of the practice effectively and well and really be viewed by them as support, it's very difficult to push change. So there's some very practical lessons learned and tools for facilitators on how do you talk to a leader, what role should they play, how do you determine kind of their priorities and really use that as a lever to get them on board, and how do you help coach them even to, for example, run more open meetings. There's also the new modules on building teams in primary care. And now what I'd like to do is just go to a couple of slides, if we could skip to the next one, Alex, and just give you a glimpse. Now these are not intended for you guys to read or really get an in-depth understanding, but I just want you to see kind of some of the cool stuff that we've got in here. So we have, you'll see there in the workflow module, we do some instruction around how do you do swim lanes. So the very basic workflow diagrams are excellent, but what do you do when it's a team? And a workflow actually involves multiple people. And so this trains the facilitators and then helps them also teach practices how to develop these kind of swim lane, more complex workflow diagrams. Tom Bodenheimer did some excellent work kind of identifying what workflows would any practice facilitator need to know about. If you were going into a practice and you wanted to come in there basically with a pretty good understanding of what matters. What are those levers or buttons that are critical to that practice? So there's a list of those workflows, and a facilitator going through this curriculum might actually use that list when they go out to do their practical experience in the field and really do observations of those workflows. So they become quickly familiar with those key important things they need to understand in a practice. Next slide, Alex. So here is just a quick dive into the meeting module, and I love this at the bottom. This is from Jen Powell and some tools that she has been using, again, to give you a flavor for kind of the practicality of some of the resources in this module. My husband used to run a museum and is very active in the art world, and a big part of what he did to make a great experience for people at the museum was to curate well the various art resources and pieces. And I think of this curriculum very much like an act of curation. It's a curatorial act, and we have helped curate some of the best resources based on feedback from our facilitators that they can use with practices. So here's an example of one of those. There's orienting facilitators here to what are the types of meetings you might participate in, and what are the purposes of different kinds of meetings. So giving them a little bit of a theoretical grounding. Next one, please, Alex. So, and then here's a glimpse into the measuring and benchmarking module. And so it orients and teaches that facilitator what is, what are they? Clinical performance measures. How do you work with a practice to select them? Where do you go to find the different types of them? And then when you're presenting this information back to a practice, what are some good ways to display this information? So we have examples of data dashboards at the individual practice level, across at individual provider levels, some of the run charts and trend lines that you can use to help people really understand their performance over time. And then also benchmarking here across multiple practices. So it's all the different ways that you can present data. And a couple of these examples are drawn, for example, from the CKD Translate project, and groups that are really out there right now in the field using data and performance feedback to change the way practices work. So with those kind of little teasers, I like to think of it as a little bit like a trailer to a movie, kind of to get you interested, and hopefully you'll go online and download the curriculum when it's available. I'd like to now pass the baton over to Jay, and Jay's going to talk a little bit about this initial module, this beginning one that's designed to basically train the trainers, help those people that are going to be working with your facilitators to train them to use this curriculum better. So Jay?
Thanks, Lindy. The expanded curriculum that you've been talking about is really designed to support the use of established adult learning principles. And these instructional principles are based on the knowledge that adult learners are really internally motivated and self-directed, and they bring lots of life experience and prior knowledge to their learning. They're goal-oriented and seek information relevant to the work that they plan to do. And they want practical applications for the learning, and they really want to be treated as equals by the people instructing it. So instruction really must be relevant and useful to learners, problem-centered and action-oriented, and build on and incorporate those experiences that the learners bring to the training experience, and really include lots of opportunities for performance feedback. The curriculum that we've developed and will be releasing soon includes an overall instructor's guide that explains how each of these principles can be applied in practice facilitator training. One way that this can happen is that trainers can work with experienced facilitators on the content in the various modules to develop simulated cases for discussion of specific topics based on their own previous work, either as a facilitator or in other medical settings. In addition, each module includes a brief introduction directed to the instructor specifically that will assist with delivering the content effectively to adult learners. So given all these things that we've talked about so far, I'd like to open things up for questions, and Lindy will have you facilitate this portion of the question and answer section.
Excellent. So thank you for that, Jay. And so I'm just going to read out some of the questions, and please, those of you listening in, submit your questions so we can try to get to those during this this webinar. So the first one, and this is a great question, is I know this curriculum is meant to be facilitated by a coordinator trainer. Some of the facilitators I work with ask me about using it as a self-study manual. Are there specific resources in the new version for how to do that? So Jay, do you want to address that?
Sure. The modules that we've developed are intended to be used in a group setting, but they do include resources that people can read on their own. There's usually, each of the modules actually has preparation work that goes prior to the training session itself. But we really think that the group experience of training is really important for getting these skills developed, especially since most of the skills that we're talking about have to do with facilitating groups and with working with groups. So there's the opportunity to use the information individually and to expand your knowledge base in that way. But I think it's preferable, in my opinion, I think, to have a group training experience if possible. We do have information in the instructor guide at the beginning of the curriculum about how to adapt these various modules to use in an online training, so that the group doesn't necessarily have to meet face to face in order to get that group experience.
Great, thanks, Jay. And I'll just share a little bit on that. We, I'm in Los Angeles, and a lot of the practices we work with are federally qualified health centers, and they're staffing up their internal QI capacity. They're bringing staff on to do that. And so we've had a number of requests to do some training of, quote, internal practice facilitators for them. And we have them using the curriculum as a self-study guide, and then we join in every other week or sometimes once a month for a learning community where they're sharing the different projects they're working on and what they're learning from the different modules. And so it is, I think, very possible to use it as a self-study guide, but also great to join in either through a listserv or some kind of online learning community to be able to exchange ideas. And that's very much the very kind of basis and foundation of facilitation, is this idea that you're sharing ideas with each other and then you can take those back to your practices. So, okay, so there's another question here that I think is also very good, and it's what sort of work do you have in the curriculum in terms of readiness assessments? And Jay, do you mind if I take that one?
Oh, go ahead.
Great. So the readiness assessment, that's an excellent question, because really at the beginning of all of this is the question, is the practice ready to engage in a facilitated improvement project? And so there are some very nice tools and resources in there for doing that initial assessment. There's even a section within the assessing practices that addresses specifically that issue, provides some questions that you might want to ask yourself and ask the practice before you begin to engage in a facilitated improvement project with them. And a lot of that information about readiness assessment comes from some of the work that Tom Bodenheimer's been doing out there with smaller practices, some of the work we were doing in LA Net with federally qualified health centers that are part of our network, and many of the other kind of boots on the ground facilitation programs. So it's very pragmatic. So here's another question. If I understand correctly, there are sample flows, meeting modules, and benchmarking data we can use as a starting point to help us build out and customize for our practices. Jay, would you like to field that one?
I'm sorry, can you, I'm not sure what.
Okay, let me take a shot at it. So Mike,
okay.
I think what this person is asking is, is this kind of like a plug and play? Here's a set of tools that you can take and run with a practice.
Yeah.
I wouldn't say that it's like a toolkit where you go and you have all the forms ready to go, but there are quite a bit of resources in there that you could just take and use immediately with the practice. For example, the sample performance data reporting that I showed you, you could certainly take and adapt for use with the practice, and there's even an online Excel spreadsheet that you could plug numbers into and help populate some of that. the link is in the curriculum.
Right.
There are some forms, for example, for a really nifty form I like for an agenda for a meeting that is possible to print out and use immediately. So there's some resources like that, and then some that you would actually kind of take inspiration from and create your own. Anything to add to that, Jay?
Yeah, so one of the things we really tried to balance in the curriculum was the provision of those kind of plug-and-play type of tools that you could use with any practice, and the development of the skills that facilitators would need for identifying those, developing them, and making new ones that they're going to need for new projects, so that practice facilitation can grow and change with primary care itself, so that we're not creating something that turns into an artifact, but rather is a way to develop a workforce that can help practices improve over time.
Excellent. Well, here's a very good one. What suggestions will you give to a new practice facilitator who does not have an experienced mentor, it looks like, on staff to guide, support, and mentor them? Do you have thoughts on that one, Jay? Or Bob, if you want to jump in, or even Darren, I know that you're on the phone also, so please feel free to jump in and field some of these if you feel so inspired.
I think that's one maybe you could answer, Lindy.
Okay, I feel like I'm talking too much. So my advice there, and this is based on my own experience, is to spend a lot of time, if you really are out on your own. One, there's a really nice, robust online community for practice facilitators, which you can connect to through AHRQ's website, that PCMH website that Bob showed earlier on in the slide deck. And there's a listserv that AHRQ is also supporting for the practice facilitation community. And so joining those would give you an opportunity to connect with and kind of begin a dialogue with other facilitators across the country. And then there are oftentimes local learning communities for facilitators. For example, I know Mike Parchman's group out in Washington have one that they've been supporting as part of the safety net practice that they did a number of years ago. Oklahoma has a listserv of its practice facilitators, and they regularly communicate. And then Ann Lefebvre's team in North Carolina has an extremely innovative way that they use their listserv, and I think they're having about 45 posts a day. It really becomes a way of knowledge exchange among their facilitators across the state. And so, you could look into tapping into those listservs and those kind of online learning communities as a way to find almost some kind of distance mentoring if you were really out there on your own. And in addition to that, spending a lot of time, one of the things I have my staff do is the requirement is, regardless of whether you're on a project or not, you need to spend a half a day or a day, a month out following clinicians and staff around, just listening and watching. Many of our best ideas and kind of deepest understandings of practices and what they need come from just going out and hanging out and seeing what's going on. And finding perhaps someone within a practice, a very experienced clinician or staff person, practice managers would be excellent, that could mentor you and help answer some of your questions and guide you as you develop this knowledge. Bob or Jay, would you add anything to that?
No, I think that's, you're exactly right. That's a tough one, Lindy. I mean, so many, I think, training programs, have a structure around them that provide opportunities for people to connect with practices, and it's challenging to do it without. But there are lots of resources out there that you've highlighted, I think, that are great.
Fantastic. So, Bob, I know you saw a question that you were interested in addressing. Could you take that one?
Yeah, I sure could. So the question is, would it be possible to share previews of specific new content from the expanded curriculum in the PCPF newsletter, and then possibly get feedback from potential users? And that's a fantastic idea, actually, because as we've highlighted, the curriculum itself won't be out until probably May or certainly at some point during the spring. And we'd like to share what we can with you in advance. So if you've been a follower of the listserv over the last year or so, you've known that every other issue we highlight one of the modules from the handbook. I think it's a great idea to start highlighting some of the modules from the curriculum, and actually we always welcome your feedback on things. We would love to generate more interactive nature to the practice facilitation listserv a bit, at least have you share your experiences with it, your thoughts about any of the information that we share. I think that's a fantastic idea. So we'll start working on what we can to start highlighting, to provide even more sneak previews like the kind that Lindy gave you today, I think, in the newsletter moving forward. And certainly we welcome your feedback on that. I think it'd be really valuable to hear from you all on those things. So.
Great. Bob, can I impose on you with another question? Because I think this is also
Sure.
a very interesting one. It says, what role can health departments play in supporting practice facilitation? Tell me your thoughts
that's a
on
great.
that.
Yeah, that's a fantastic question. And this is really, there's a convergence here between primary care practice and sort of the broader sort of population health management things, often the functions of health departments. And there's different situations in different states. In some states, there's good cooperation between organizations that are helping support primary care as well as the public health organizations. And I think actually sort of making those connections is going to be an important part of this being successful, where that there's nice connections and linkages between primary care practices and health departments can help support primary care as they move into some of these new models of care where those whether it's care coordination or linking with resources that are offered in health departments are really going to be critical to success and actually getting to population health improvements, I think. So I think there's some really important linkages there, and it's going to have to go locality by locality, but working with both on the medical side and the public health side, I think is going to be key to the future success.
Great, Bob. Thank you for that. So here's another question that is very good, and it says, will the new version include any information on practice recruitment and ongoing engagement? And so there is within the curriculum information about how to, conduct a kickoff meeting with practices, how to engage them once that practice has been enrolled and signed up for a facilitation intervention. But I think this question is really getting at kind of that bigger issue of how do you get a practice even to want to, begin a conversation with a facilitator. And there's another toolkit or manual that AHRQ has developed, and Bob referenced early in the slide deck about starting and running a practice facilitation program. And there's quite a bit of content there, both on this issue of how do you assess initial readiness of a practice to engage, but also how do you get practices to want to enroll and participate in a facilitation intervention. So I would encourage the person that asked this question to go. That one is available online right now at that site that Bob showed you. And that has excellent and fairly comprehensive information about strategies for doing that.
Lindy, this is Jay. One other aspect of that is something that we've developed a new module on for this expanded curriculum, which is working with and supporting practice leaders. Because I think making sure that the leaders of primary care practices are fully engaged and are able to work with a practice facilitator is a key part of maintaining that engagement over time.
That's great. Thank you, Jay. So here's a good and I think very important question. It says, how can these new tools be used to help support practices as they prepare for new payment models? For instance, will there be modules added on high-risk patients and care management techniques? So Bob, Jay, or anybody on our team here want to respond to that question?
So I'll just jump in because I think this is a great question, and it sort of begs in my mind, how adaptable, do we see this curriculum being in the future as things begin to change? And I'm not sure that we want to get what we have on the street. I think will be our first step. But clearly, what we've tried to add in the curriculum is a sense that healthcare is going to change a lot over the next 10 years, and providing some skills at least so new practice facilitators know how to keep abreast of those kinds of changes. And although we may not be able to, I think we probably have not, at least specifically in the curriculum, addressed every potential new payment model or even thought about where they go or what the implication might be for every practice. I think what we've tried to do is give people a baseline level of knowledge and expertise that will allow them to absorb those kinds of new delivery models that come out and then help practices adapt in important ways. I'll just say one other thing and then I'll stop there and let you guys chime in. Is I think it'll be great when we move to the next phase of this conversation shortly, and we might be able to hear a little bit about the importance of this sort of role in adapting to new delivery models. So I think there's more to be said about this, but at least that's my take on it at this point.
Excellent.
Yeah, I would just add to that, what I've said a little bit before, which is that the focus here has been on, as Bob mentioned, the foundational knowledge, but then also developing skills that can be used for all kinds of different organizational change in practices, including those that were just mentioned. So really trying to build up the skill set that's needed to help practices make changes to adapt as healthcare itself changes.
Very good. And certainly nothing would stop the facilitation community from encouraging AHRQ and other groups working in this area to develop materials on this. I think that they're going to be very important. I know this is an area that Anne Lefebvre's program in North Carolina pays a lot of attention to, as these, it's really the hook that gets these practices interested, especially the small independent practices that are struggling around some of these issues. And so I think it's a very important topic, and I hope that more materials are developed around it soon. So here is, Jay, I think a good question for you. It says, it sounds like this curriculum may be able to be used in a virtual format if done well. What are your thoughts?
Yes, I think it is. We certainly have tried to design it in a way that it can be used in a virtual format, and the previous handbook has been adapted by an organization that we profiled in our case studies to use in an online way. Now, in our instructor's guide, which is at the beginning of this curriculum, we have a separate section on the issues around teaching in the virtual environment and how to manage that. So there are a lot of specific challenges to adapting to managing a group over a virtual environment, and we've offered some resources and some guidance on that in the instructor's guide.
And I think it's also useful to note that there's SUNY Buffalo has taken the practice facilitator handbook and has basically a certificate program for practice facilitators, and the training is done almost entirely virtually. The students participate in a virtual classroom with each other, so it's live, and June Levine is the faculty member for that. And then they go do in their own communities mentored experiences, and we just started working with Alaska. It has a couple of students that have joined virtually that program, and they're going to be doing a mentored experience in Alaska. So we're spreading out across the entire country with that type of virtual support and training. So yes, it can, and I think it so far is working very well. And by necessity, a lot of these facilitation programs, especially as it grows over time, many states are looking at really creating statewide infrastructure, is the training is going to have to be delivered, at least in part virtually, because you're working with a workforce that's spread out across a very large geographic region. And I know Anne Lefebvre, and there's a case study also up on that AHRQ website that Bob showed you of the North Carolina program and how they really provide training and support to their facilitation teams that are spread out across the 9 AHRQ regions of that state. And so they have a very elaborate kind of process of virtual training, followed by, I think there's quarterly on-site workshops. But much of the training is really delivered virtually. So
Yeah.
Jay, any questions you're seeing in the list that you'd like to bring out and talk about?
Well, one that's come in that I think is interesting is, are there pathways for patients to become practice facilitators? And is that addressed in the curriculum?
I love that question.
Yeah, I do too.
So thank you for whoever asked that. That's fabulous. There is not a full module or kind of deep content on that in this particular curriculum, although we've been in discussions around that. And we have, at the end of the team formation and kind of optimization module, there are some wonderful links, kind of curated resources around what they call experience-based redesign. And this is a process. My team actually used it recently in the VA here in Los Angeles, where you partner with a patient, and it's inspired partly out of some of the lean processes to map and then redesign patient care visits. And in the process of this, the patient and community member really becomes a partner with that facilitator and the clinical care teams in promoting change and really building that care experience around the experience of that patient. If I were to talk right now personally about the thing that I am most excited about in practice facilitation, it would be that, kind of bridging that gap with that patient and really engaging them as a partner. I think many other industries have done that much more aggressively and proactively than healthcare, and so I think the time is right now to do that, and facilitators are an absolutely fantastic tool to help make that happen. Jay, other questions you see that?
Yeah, there's another one here. What professional backgrounds do most practice facilitators have? And is there a specific one that works best?
Do you want to field that, Jay?
Sure. I think what we've seen in our examination of existing training programs is that practice facilitators come from lots of different professional backgrounds. Many of them have healthcare experience of some sort, but it doesn't appear that it's an absolute requirement. Knowledge of the primary care environment is really important, and what we've tried to do here is to provide the introductory information to get people up to speed on that. But certainly the personal skills, the people skills, the ability to help organizations figure out how they need to change and help them change, I think is really kind of the essential.
Great.
Yeah, if I could just jump in, I've been running into a lot of practice facilitators recently, and this is pure anecdote, but I'm finding that at least in the sort of new generation coming into this, many are out of just graduate school with an MPH and have an interest in healthcare and are looking to make a change, and they have jumped into this without a ton of background, but a little bit of practical experience and some knowledge of healthcare, and it seem to be working out very well. So it's an interesting, I think, future for the profession.
Excellent. Bob, thank you. I see a question here I'd like to ask you to talk a little bit about. Does the manual include a crosswalk with Joint Commission and CMS requirements for PCMA, for patient-centered medical homes? Can you talk a bit about that?
Just a little bit. I mean, that's a great question. And so at AHRQ we try to stay agnostic about specific PCMH certification programs. But I think we developed what I think is a nice module to give over an overview of PCMH recognition programs. So it definitely contrasts the programs out of NCQA as well as those out of URAC and the Joint Commission and the Association for Ambulatory Healthcare. I don't recall if we specifically talk about CMS's requirements in there, but I think there's some pretty good overview information that looks at how those different programs cross each other, and I think we thought that might be particularly valuable to folks as they're wrestling with which recognition program should I pursue and what are the requirements for each. So I think that's a great question, and hopefully we've offered something of value in the curriculum.
And just to follow up on that a bit, Bob, on your comment about being agnostic, I mean, we really tried to keep that module focused on the principles of the patient-centered medical home and really helping providing a resource that will help practice facilitators to really understand why they're working with practices to implement whichever one of these programs it is, and to keep it focused on the things that matter with the patient-centered medical home, and to try to move practices beyond the checklist approach to the PCMH.
Great point. Thanks, Jay.
So here's a question. I think it's interesting, and maybe all three of us can weigh in on it. It says, what roles can professional associations and professional societies play in training facilitators, essentially?
Yes, it's a moment of silence there as we think through this. Jay, do you want to start, or
I have something.
You go, Lynn.
So I'm working on a project right now with the American Association of Physician Assistants. And so one of the things that we've been doing, it's really focused on, there's another question that has to do with, is there a module on pushing out evidence-based practice and some of, I guess, the P-Core into the practices. And there is some content on that because as Jay and Bob, I think, both mentioned early, there's some kind of core skills that we're teaching these facilitators, understanding that healthcare and kind of healthcare models are a moving target. And so how do you equip a facilitator not just to regurgitate content, but also to be able to become almost a broker of resources and information, to become a curator, as I've been talking about earlier, of information for practice. There was a wonderful article that came out a couple of years ago.
Welcome to Cisco Meeting Place Express. Enter the meeting ID number followed by the pound key.
Hello? Can you guys hear me?
I may have lost it for Ginger.
Okay.
I'm not sure.
Okay. I see that David is trying to join and saying he's having some trouble, so I bet that's what we're hearing. Alex, maybe you could check into that. But there's this wonderful article on, it's called Brain Freeze. It came out several years ago, and it talks about basically neurologically what happens when you're bombarded with too much information. And basically it says that your frontal cortex almost shuts down and you have trouble making decisions, and then you get frustrated and get emotionally labile, and it sounded very much like me trying to plan a trip online. But what the facilitator is, this curriculum helps the facilitator learn to do is kind of prevent that brain freeze from happening for practices, because they can go online and start looking for resources on care coordination or care management or these payment models and quickly get overwhelmed and then just give up, even if they have the time to do that. And so the facilitator, one of their key skills is knowing how to look for these resources both online and then across the kind of local or national community of facilitators, and find those kind of pearls that are the most relevant and most easily adapted and used by practices. So that to me is a really important part of that kind of how do you help, is there training to help these practices implement new evidence and new approaches. The role of professional associations and societies, though, with this project with the AAPA that we're doing, we're providing some training online through virtual training of physician assistants across the state of California, both around new evidence, which has to do in this case with preventive care services, but also on quality improvement processes and how would you then work with the practice you're in to redesign workflows, set up clinical decision supports, and then one of the most important outcomes has been how do you get patients engaged and wanting to follow through on these recommendations. And so all of that is happening really in this partnership with the American Academy of Physician Assistants. And then they're recording many of these sessions and putting them online almost as podcasts on their learning website, which could then be used, again, kind of as self-study for other PAs across the country interested in doing these things. So that's one example that jumps immediately to mind. So with that, I think that, do we know if David's been able to join the session? David, are you here? Okay,
I am, but I was on mute.
Oh, there we go. So welcome, and I am going to pass the baton now to Bob McNellis, and he will introduce our two very special guest speakers. And I have to tell the audience I've been a little bit starstruck preparing for this one, having both David and Darren on the session. So we're very excited to have them here. And Bob, if you will take it away.
Great. Thanks, Lindy. And nice job with the Q&A there. And thank you all for your great questions. There are many good ones here that we still haven't gotten to, but as Jay mentioned at the outset, we will do our best to get back to you with some answers on those. But right now, it gives me really great pleasure to introduce you to two people who I've worked with for many years and have amazing respect for. And let me just give you some brief biographical information, and then we'll move into some nice discussions with them. So first one up is Dr. David Myers. And David is the acting director for the Center for Evidence and Practice Improvement, as well as the chief medical officer here at the Agency for Healthcare Research and Quality. And David's a board-certified family physician and leader in primary care research and organization, and he serves as AHRQ's chief medical officer, as I mentioned. Before he was here, as the chief medical officer, he has led the Center for before it was even the Center for Evidence and Practice Improvement, where he led AHRQ's Improving Primary Care Initiative, oversaw the Center's work in supporting the U.S. Preventive Services Task Force, as well as the EPC, the Health IT portfolio, and the Decision Sciences Group, as well as our little group in the Practice Improvement Division. His recent publications have focused on primary care transformation, the evidence for patient-centered medical home, the primary care physician workforce, and foundational thinking about building capacity for ongoing and systematic quality improvement in primary care. And so, David, welcome. Thank you for joining us today. And I'm also going to introduce Darren DeWalt. And Darren is the Director of Learning and Diffusion Group at the Center for Medicare and Medicaid Innovation, and Associate Professor of Medicine at the University of North Carolina School of Medicine. As Director of Learning and Diffusion Group, Dr. DeWalt leads an expert team in designing and supporting improvement and learning activities across the Innovation Center's portfolio of new models of care. It's important to know that prior to joining the Innovation Center in 2014, Dr. DeWalt was on faculty at the University of North Carolina, where he was Associate Director of the UNC Institute for Healthcare Quality Improvement and led local, state, and national programs to improve quality of care. He's conducted numerous research studies on models of care delivery, improvement of quality, and measurement of health, and he's a practicing internist. So it's my great pleasure to welcome you both. And I wonder if, David, you might start off by giving just a few opening remarks and then hand it off to Darren, and then we'll have a little Q&A with Lindy again. So thank you both for joining us.
Thank you so much, Bob and Lindy and everybody on the call today for being with us. Bob, I'm blushing at the moment. That was way too kind, but thank you. I actually, in that thank you, really, again, to thank Bob and Lindy and Jay and their teams, both at AHRQ and NPR and LANet, for all their work over the past year in making this curriculum become a reality. One of the things at AHRQ we try to do, we're a relatively small agency focused on how we can help the healthcare system care for the patients across America, all patients, improve the quality of care, the affordability of care, the accessibility of care, and really doing that by bringing evidence and helping people use evidence. But given that that's a monumental task, we tend to focus on areas where you and stakeholders like you come to AHRQ and say, this is the area we're struggling with. Here's the gap. And when we can find gaps in evidence or gaps in translating evidence into practice, that's our sweet spot, where we try to be the R&D shop that help you make care better. And so the curriculum here is really a wonderful example of that in action. AHRQ several years ago, more than 5 now, really decided to focus on what can we do to help primary care. And that was based and built on the foundational belief that primary care is the secret sauce for building a healthcare system that delivers high-quality, affordable care to all Americans. For years, we've believed that, but things have changed recently with the creation of health reform. One of the missing pieces, a finance system that would make all of our dreams about what primary care could be possible, started to become a reality. And so we were there saying, well, if that's going to come along, how can we help primary care be ready, and the primary care clinicians and the systems they work in be ready to take advantage of this new opportunity? We are already invested, and you can look at our website at arq.gov for some of our materials about what we see as the power of primary care to deliver patient-centered care, team-based care, well-coordinated care, improved accessibility, many things like that. And a lot of that got wrapped into our work on the patient-centered medical home. But when we talked with folks about that, they said, that's fine, but folks are working really, really hard in the 20th century model that they are responding to, that the financial incentives had led them to. And how can we expect them to just miraculously transform into this new vision, even if the payment system is now creating new incentives. And some more Machiavellian colleagues said, well, we should just let those who can't change fall apart and disappear, and let those who are innovators and can embrace this opportunity thrive, and then eventually those that thrive will spread out and populate the whole landscape. And while that may be good for species evolution, we were worried what would happen to Americans if primary care suffered before it was able to succeed. We realized there's already difficulties with access to good quality primary care, and we needed to be able to help everybody in this field improve now that we have this opportunity. And you all came to us and said practice facilitation is a model that really works. We went out and looked and helped show there is evidence that this worked. We built materials under Lindy and her team's leadership of how to start a practice facilitation program. We have a listserv that I think many of you are on with over now 500 to 600 people engaged in how to run a practice facilitation program. And those folks said to us, this is great, but the next thing we need to know is just a simple, clear guidance on how to train them. And that's where the idea for all the work that you're hearing today, that you heard about today, came from, that getting you the tools you need right now so that you can begin or continue helping to improve practice. Before I was allowed to sell this project, I'm sorry, Bob? Okay, I was getting some feedback, sorry. Before we were given the go-ahead and the green light to do this, the leadership at AHRQ and in the Department of Health and Human Services said, okay, sounds like a great idea, but can you show us there's going to be a demand for it? And one of the most important things we were able to do is point out to them the multiple projects happening around HHS that could benefit from this type of people using this type of curriculum. That started at AHRQ with our impact grantees, which I'm sure you've heard about on the call today. But it expanded as we talked about, and I know Darren will talk about the Transforming Clinical Practice Initiative when we look to our colleagues at ONC, the Office of the National Coordinator, and the Regional Extension Centers for Health IT. When we talk to our colleagues at HRSA and their work in supporting federally qualified health centers and improving the quality of care they deliver, and their excitement for practice facilitation as a model in partnership with primary care associations potentially across the country. And the legislation itself, the Affordable Care Act, which put in motion a lot of this work, when it said to us that a national primary care extension service was something AHRQ was authorized to do. And so all of that came together to both give us the green light for this curriculum and also to launch a project which we'll be announcing the grantees later this spring, Accelerate, which we colloquially call Accelerating PCOR, 8 regional collaboratives around the country, each working with over 250 primary care practices serving over 9 million Americans, and to see if we can not only support them in improving through practice facilitation to improve the quality of the care they're delivering, but actually build their internal capacity for improvement. So I hope that's consistent with what the team's been saying to you before. And Darren, I'd love to turn it over to you to hear from you if we got it right.
Thanks, David. Sorry I had to take you off mute. And thank you for inviting me to speak on this webinar and to join you guys at AHRQ today. It's really impressive to see how much the field of practice facilitation has developed over the past 10 years. And I've personally found it particularly helpful that AHRQ and partners like LANet and Mathematica have continued to consolidate the learning about practice facilitation into curriculums and handbooks. I think you guys have demonstrated tremendous leadership in this area and really helped all of us in our work related to practice facilitation. And I think as a result, we've seen dramatic interest in spreading this technique for helping practices, as you evidenced with the number of people engaged in these webinars and the listservs that you've set up. As you know, I began my work in this area when I was at University of North Carolina, and back in 2005 when we were launching the Improving Performance in Practice program. And back then, we needed a way to reach a lot of practices and didn't feel that traditional methods at that time, which were focused a lot on breakthrough series collaboratives, which are fantastic, but we felt that that wasn't going to reach all of the target audience that we wanted, many of the practices that you were referring to, David. And as such, we began using facilitators combined with other group learning events, and found that it was a very powerful technique and that practices loved the facilitators. During that time, I had the opportunity to see several state facilitation programs emerge. And because I was in North Carolina, I had the privilege to work directly with teams at North Carolina AHRQ and the Community Care of North Carolina and see how their programs have developed over the past decade. And I think I also had the opportunity when I was at University of North Carolina to lead one of those impact awards that you referred to that AHRQ funded. And in North Carolina, we were really committed to creating the infrastructure of practice facilitation that could help us meet the aims of improving healthcare and health outcomes. And always trying to say, what is the infrastructure need and how do we use that infrastructure continually to keep reaching new aims? And this past summer, I joined the CMS Innovation Center and moved up here to Baltimore, and now working on several new models of healthcare payment and delivery. And I want to mention a couple of principles about our work here at the Innovation Center and tie this back to the importance of practice facilitation. First, the Innovation Center is committed to achieving the goals put forth by Secretary Burwell of achieving better care, smarter spending, and healthier people. And to do this, we test new models of payment and care delivery. And it's really important to note that it's not just payment, and that we recognize that payment is critical, but that it must be accompanied by changes in the way care is delivered. And as such, all of our new models have learning systems that exist to help practices or health systems implement the new model of care delivery at the same time that we're changing the payment incentives. As an example of this is the Comprehensive Primary Care Initiative, or CPC. And in that initiative, we have 500 practices in 7 regions implementing a new model of care. And in these regions, we have local faculty that are using many of the techniques of practice facilitation to assist with the implementation. And I think that the curriculum that you developed will be incredibly informative to local faculty in regions that are trying to assist primary care practices to implement programs like comprehensive primary care. Secondly, CMS and the Innovation Center believe that we need to work together with the provider community more broadly to transform care delivery. And a good example of this was the Partnership for Patients, where we engaged most of the hospitals in the country in that work. And what you mentioned, David, that Transforming Clinical Practice initiative is really our second initiative along these lines and is targeting ambulatory care practice. And the aims of TCPI are very grandiose. It's a very big investment. We want to, 1, support more than 150,000 clinicians in their practices, 2, improve health outcomes for millions of Medicare, Medicaid, and CHIP beneficiaries and other patients, 3, reduce unnecessary hospitalizations for 5 million patients, 4, generate $1 to $4 billion in savings to the federal government and commercial payers, 5, sustain efficient care delivery by reducing unnecessary testing and procedures, and 6, build the evidence base on practice transformation. That's a lot that we have to do over the next 4 years in that initiative, and as you know, practice facilitation is a method that I suspect many of the practice transformation networks could use to achieve those aims. The last point I'll make is that healthcare is in a very rapid state of change right now. And we have a strong sense of urgency to improve quality and reduce cost. And at CMS, we know we have a major role to play in this. But even more importantly, the practice facilitation programs and other programs out there that assist with the actual transformation of healthcare delivery at the point of care are where the rubber hits the road. And it's the success of those programs that will determine whether we can reach the aims of better care, smarter spending, and healthier people that we need to do for our country. So I really see a lot of promise in the work that you've done and the consolidation you've done on the methods and the curriculum around practice facilitation, and think it's a key piece in how we advance our healthcare system. I will stop there, Bob and Lindy, if you want to take it from there.
Excellent. Thank you so much, Darren and David. It's very exciting to hear the ideas and this vision that you're laying out for both this transformation in healthcare across the country, but also the role of practice facilitators in this. And I want to ask you just a very practical question. If you were to share, going back to this curriculum, what your dream or vision is about who might use this curriculum and how they might use it, could both of you speak briefly about your ideas on that? David, how about you first?
Wow. No, Lindy, I don't know if I had thought about it quite that way. We know that there are there are many levels. I guess my dream would be that it would be used by many different types of folks. I'd love to see it being used by the accelerating P-Core grantees at AHRQ and some of the PTNs that CMI will fund through the Transforming Primary Care Clinical Practice Initiative, and as well as the REC. So existing large federal either research and delivery system reform programs. But if it's only used by us, I don't think we're going to nearly tap its potential. I'd like to think that health systems who are now getting much more engaged with ambulatory practices will see the curriculum as a way that they can train their staff, either new staff, practice facilitators that they hire, or quality improvement folks that they already have, but into this new role and get them out into communities. I can imagine states, either primary care associations, state health departments, other folks, North Carolina or Vermont have examples of this already, but there are other places around the country where I think state and local governments could get engaged in using the curriculum to train their staff. Health insurance plans who have invested in the past in ways that centralized, if they would shift a bit and train their quality folks to get out into communities and work with docs using the curriculum to train their folks about how to truly partner on an ongoing basis and what primary care really needs and how it responds, that would be a win. So those are just some. Darren, do you have any others you want to add?
Just some, David. That's a lot. You covered most of the ones that I was scribbling down, preparing my answer. I think what I would add to that is when I have seen the earlier handbooks and see what you've developed on this curriculum, it really strikes me as you're covering a lot of ground that is getting at the fundamentals of how do you change clinical practice to a new model of care. And I think anyone that's in that business would want to review this curriculum, and they would probably specifically want to think about practice facilitation skills as a component of their overall strategy. But the curriculum really goes beyond that a little bit and gets at these fundamental issues that we all need to think about in supporting practice change. And the other thing that I'll comment on that David mentioned also is we talk a lot about practice facilitation programs as they exist sort of in supportive environments outside of individual practices or systems. But I think health systems themselves, as they think about changing their care delivery, will probably want to use this curriculum to support the individual components of their system.
Excellent. Well, Darren and David, thank you so much for that. Here's a question that came in for both of you guys. So if you could speak to this, I think we've got time for one more, is what do you see in the future for the role of practice facilitation at AHRQ and at CMMI? And you've touched on it some, but what would you say to this person that posted the question? Darren, you want to take this one first?
Sure. I think that as CMMI is doing the best job we can to engage with the healthcare delivery community, I anticipate that practice facilitation will continue to be an important strategy that we use and that could be funded through some of our mechanisms to help practices make these changes. I think it's been established now that practice facilitation is a core strategy in doing that work. I think Transforming Clinical Practice Initiative is a very good example where I anticipate there will be a lot of practice facilitation.
And so, Lindy, I'd add that, I think in my mind, practice facilitation is reaching the level that we can recognize it as a proven tool. AHRQ is not, I don't think, is not going to be focused on supporting and promoting practice facilitation in and of itself. That's not the goal. And in both the TCPI initiative and the Accelerating PCOR initiative that we've described, both of these initiatives have built into them a real interest in learning more about not does this work, but how does it work, for who, at what level of titration, what dose effect might it have, can we do it virtually? So we're going to have some interest moving forward in better understanding the evidence base about how, sort of the comparative effectiveness base even, of how to make practice facilitation work. And we're, I think, starting to see the place where it no longer will be a question of, should we be doing practice facilitation? It's similar to, should a practice have an electronic health record? It's going to be, how do we build a sustainable system that uses this tool to make the most benefit for the most folks? And I like the way Darren said it. It's about, smarter healthcare, better healthcare, better information flow. So all of the Secretary's goals.
Great. Well, David and Darren, I want to thank both of you all for joining us. It's been a real treat to have you on this session, and really appreciate the insights you shared, and also all those great ideas about who can use the curriculum. And now I would like to just pass the baton now along to Jay and Bob to wrap up this session.
Great. Well, thanks, Lindy, and I will second your thanks to David and Darren for attending the webinar today and contributing their thoughts on practice facilitation, and to you and to Bob for your comments as well and for your contributions all along. And I want to thank everybody for attending the webinar today. As Bob mentioned early in the presentation, the expanded curriculum will be available publicly in the near future. And to make sure you get the first notice of that release, I encourage you to subscribe to the Practice Facilitation listserv by sending a message to practicefacilitation@mathematica-mpr.com and just include subscribe in the subject heading. As you may know, and Bob mentioned a little bit earlier, we've had 4 prior webinars on topics of interest to the practice facilitation field, and you're welcome to access those through the links on this slide here. And everything is there, the video and audio, and even the questions that were asked. Finally, we have some recently released case studies of how exemplar training programs are preparing practice facilitators to work with primary care practices, and those are already available online as well. I hope you'll take a look at these resources and sign up for the listserv, and thanks again for attending today's webinar. And that concludes our webcast for today, and I invite you to submit feedback to our presentation team in your browser window when the event concludes. And if you're unable to provide your feedback at this time, you can view the on-demand recording of this event and access the survey widget there. And that on-demand recording will be available about approximately 1 day after this webcast is completed, and can be accessed using that same audience link that was sent to you earlier. Thank you all, and have a great day.